introduction and for the opportunity to speak to all of you today. There's this awkward hole in the middle there. Sorry about that. And welcome back from spring break. I hope you all are feeling rested and happy to be here. We are talking about wartime China, so we got to give you a little bit of context. First, this is one piece of a book project that I'm working on that has 3 parts, each of which has 3 chapters. So the bulk of the talk that I'll get to at the end today comes from the very last of these chapters. The first section in the book deals with what the nationalist state under Chiang Kai-shek was able to do for basic public health needs in the city of Chongqing and its surroundings, basically what's called Free China, or the area of China that was unoccupied by the Japanese. So this is everything from disinfecting drinking wells to collecting trash to vaccinating people on the streets. The second part looks at the labor of women and the labor of men primarily as soldiers for a gendered story of the war. And the third part really looks at what happened with the particular medical practices, that is, traditional Chinese medical practices and Western medical practices in this context. So to give you other context about what is wartime China, in 1895, Japan invaded Korea and won both Korea and Taiwan as colonies. So Korea didn't officially become a colony right away in 1895, but by 1910 it's a colony. So Japan has a toehold onto the Asian mainland. By 1931, they have taken all of Manchuria as a colony. So some people date the beginning of World War II to 1931. July 1937, there's a skirmish outside China's capital of Beijing. Sorry, that's not the capital in 1937, it's the capital now. And that begins a full-scale war. Because Japan has Korea and Manchuria interlaced with all of these railroad networks, which you may be able to see on the map, they have immediate access to a bunch of troops to pull in to start invading, and they come down very, very quickly. So by December 1938, they're invading Shanghai and then Nanjing. Shanghai is China's most developed cosmopolitan city at the time with the largest number of highly educated professional people, and Nanjing is the seat of the nationalist capital. They lose their capital city by December 1937. They first go along the Yangtze River, the famous massive river of China, to Wuhan, the city of central China there. And make that their capital, their first provisional capital. They only hold it for 10 months. October 1938, that city too falls to the Japanese, and they go to the city that they had planned as their retreat, Chongqing, also moving along the river. Now, right about where this circle comes is where you have the Three Gorges Dam today, that dams one of the world's largest rivers, the Yangtze, and produces a massive amount of hydroelectric power. Prior to that damming, these were some of the most dangerous turbid waters in the country. In order to get a boat over those rapids, you had hundreds of boatmen literally tethered to a boat with ropes and bent over doubled to pull the boat over. And the water could switch and in a second just capsize. So you have stories, tragic stories, of people trying to get to Chongqing and dying just before they get into the city by drowning through the capsize. As the government retreats there and is starting to set up in late 1938, a new provisional wartime government, millions of people follow as refugees. An estimated 95 million Chinese became refugees during World War II. That was 26% of the population. So 1 in 4 people is on the move. Most people tried to move only a short distance away so that they would still be able to hear by rumors whether or not the Japanese had left, or if the Japanese were staying, were things returning to normal, can we go back home? They wanted to stay close to their homes, their farmlands, their grave sites of their ancestors. They didn't want to leave the entire home. So some people went on foot. Some people had to go further away, and if they were lucky, they would get access to a rail car. Sometimes not even an official passenger rail car. Sometimes if they're very, very lucky, they can get into a train as a passenger. This is what one scholar, Stephen McKinnon, has called the greatest forced migration in Chinese history, with, as I said, 26% of people on the move. So to put this in perspective, this would be as if everyone from Washington, D.C., Boston, and New York moved to Dallas. And that's in comparison in terms of geographic distance and also cultural distance, right? Imagine the Texans in Dallas welcoming all the people from DC. Are they going to welcome them with big, happy smiles on their face? There's going to be a little bit of tension, right? So there was that tension. The people of Sichuan speak a different dialect of Chinese. The tones are different. It's not always immediately recognizable. People coming from Shanghai speak a completely different language that no one but the Shanghainese can understand, right? It's a mix of dialects. They're all Chinese people, but they're not necessarily best friends, right? I just want to give you that perspective. And you can see, the size of Sichuan province is larger than France. Now this is a little bit of a misleading perspective because Sichuan at the time in World War II was divided into two provinces. Western Sichuan, which is mostly Tibetan, was actually part of the Tibetan plateau and would be today a part of independent Tibet if that country existed. It was called Xikang at the time. But now Sichuan province is that size. It's the size of France. So we're not talking about a mild change in life if you had to migrate across this. Once you get to Chongqing, what do you see? Chongqing is a river port city. The first site you see is something like this, with all of these jiaojiaolou, the hanging foot buildings that are built right up to the river's edge, right? These are a lot of refugees. You have a close-up here. These types of makeshift dwellings were called colloquially during the war Kangjanpeng, or War of Resistance Shacks. The name for this war in Chinese is Kangzhan, Kangri Dazhanzheng, so the war of resistance against the Japanese. And these were the shacks that those refugees lived in, the poorest of the poor, people who might have arrived on foot with just the belongings that they could carry, and then they're living in very, very squalid conditions. To give you a perspective of the actual city, as of 1944, this is towards the end of the war when the Nationalist Party has already been busy building streets, trying to clean up the city. This is what the central banking district looks like, right? You have some buses. They're not running very often because by this point gasoline is really expensive. Very few people can afford any kind of motorized transportation at all. You have people, these are called rickshaws, that are pulled by human labor. Those are still in operation, even though the central government had tried to outlaw them because they're deemed as unsightly, attempted to outlaw them within city limits, but they're still there because that's one of the best ways you can get around. Chongqing now has 9 central business districts. This is the central one, right? And it's one of China's largest cities. In fact, it's usually cited as the largest with a metropolitan plus surrounding county population of nearly 30 million. Okay, so during the war, the population also nearly tripled, but doesn't even shine a candle to the amount of change we've seen in Chongqing since the 1980s economic reforms, just to give you some perspective. So looking at Chongqing currently, from the air, you see that it is this riverine port. You have the Yangtze on the left, the Mother River. It builds up a lot of silt, and it has this lovely brown color. The Jialing is a tributary of that, and they unite at this isthmus. During the war, this was really, Chongqing was just concentrated right here and then a couple of the outlying areas. Now it's expanded way beyond that. We're looking at the same isthmus here. So the government and most of these refugees are arriving in late 1938. By May 1939, just a couple months later, May 3rd and 4th, the city is subject to its most devastating air raids. These are the 2 most devastating air raids, in part because the city wasn't fully prepared yet. They had to dig by hand air raid shelters into the limestone mountains. They hadn't yet fully dug all of their air raid shelters. They didn't yet have the finely polished air raid warning system, whereby they had special lanterns at promontories, and you could see the different colored lanterns and the level at which they're rising and falling and hear the sirens. This is a different perspective from the majority of the war period, even though Chongqing had air raids throughout the war, with a little hiatus when the US and Japan started fighting in the Pacific and they got very busy over there. Chongqing ultimately did have enough air raid shelters to house everybody. But there were big asphyxiation cases in June 1939, August 1940, and June 1941. So in each of these three very documented, well-known cases, several hundred, if not thousands of people died inside the air raid shelters from asphyxiation. So the air raids were dangerous for a variety of reasons. This photograph, which is held in the Library of Congress, it's actually taken by the United States military, is a very wonderful one because it illustrates that you have the city concentrated here at this isthmus between the two rivers. And the Japanese can, on a clear moonlit night, bomb at night, even if you are practicing complete blackout. Because guess what? The moonlight reflects off of these two rivers. So from the perspective of public health, people had to not only fight contagious diseases that were rampant at this time, but they started experiencing a lot of psychological distress. Because during the air raid season, which was when the skies were clear, they could be called out of bed from their day's work at any time for an unknown period of time. It could be half an hour, it could be 8 hours, to go sit inside the air raid shelter in the dark. And I mentioned those asphyxiation cases. Those came because too many people were in the heart of downtown, and too many people crammed into the same one air raid shelter, which was the closest one where they happened to be, and didn't get enough air circulation during that time. So it was very, very dangerous. You have cases of women giving birth in the air raid shelters. Obviously, hospitals had non-ambulatory patients, so they had to have their own private air raid shelters right nearby, and they would have their staff immediately at the beginning, the first siren, start sending their patients in there. And you still had some people who didn't get into the shelters, would get wounded. This is a photograph of Chinese Red Cross people caring for air raid victims. And after an air raid, you had a lot of cleanup to do, because some of the bombs would destroy buildings, all of the brick and stone buildings, by impact and just create a bunch of rubble. So here are people out here, and what they're doing is collecting all of these bricks. They can be used again for rebuilding, right? If they're not totally crumbled into dust, you can use those as building materials. Just another photograph of the destruction, which was intense. And the other thing that the Japanese used, taking a lesson from the Allies who were killing Japan with incendiary bombs, is they also used incendiary bombs. China as well had a lot of wooden construction, and Chongqing was set aflame. Every single neighborhood had to have its volunteer firefighter force, and they would try to put out the fires as fast as they could, but on many, many separate occasions, Chongqing was left just looking like a skeleton of its former self, just completely devastated. But people at the time wrote about how so many times the city remade itself, made itself anew, and really seemed like a phoenix rising from the ashes. It would just, people would come out, gather the bricks, rebuild, even though the next air raid is coming and people know it's on the way. There were new clinics and new hospitals being built throughout this time period. So just to give you a sense of another particular issue that was central here is the issue of soldiers' health, right? Chen Ziqian, who's been celebrated as China's father of public health. The high rate of death among the people, the prevalence of disease, and the frailty of people's physique are terrible obstructions to the replenishing of soldiers and the progress of national construction. So by the time of World War II, most countries who were belligerents in the war had gone through an epidemiological transition such that their fighting forces were more subject to death by direct fighting than death by disease. This was not the case for China. most of its soldiers, and this is very hard to prove with solid numbers because data are so thin and not reliable, but it's pretty likely that most Chinese soldiers were dying from contagious illnesses. Dysentery, cholera, typhoid, and typhus were the main killers, malaria as well. So you've got five main killers before they even got to the battlefield in many cases, or shortly after they had gotten there. Because remember how huge China is, and you're fighting battles on many different fronts. The Japanese have tons of reserves, and they're coming via Japan, Korea, Manchuria, and you're having to sometimes force your recruits to march hundreds of miles. Look at what these recruits look like, circa 1944. These are all young recruits. You can tell that they're not even getting enough basic nutrition. How are they going to be able to carry a heavy pack, hundreds of miles? And then once they're living in the recruitment camps, they're jam-packed like sardines in these makeshift quarters. If one of them gets a contagious disease, it just runs like wildfire through the barracks. And it's really a public health disaster. So this is the context in which we're looking. Cultural context, these soldiers are coming from areas where they've seen their family members, people that they know from their villages, have to bow to the Japanese who are invading, coming in with bravado and a sense of superiority, which is what the Japanese army built its own training for its soldiers on, this sense of Japanese superiority. We are here to lead the Asians. We have the right to this territory. So just to recap, you have major loss of territory, and within that loss of territory, that pink area on the first map, is the area from which the nationalist government would have extracted most of its tax revenue. So now it has to completely rethink how it's going to finance its central government. All of these people, 26% of the Chinese population, is relocated and migrating. You have that sense of cultural dislocation because it's such different distance in cultures. People who had to relocate oftentimes were doing so because the Japanese soldiers, when they came in, burned the village to the ground. They don't have any more property to return to, even if they could. The Japanese army would also requisition grain stores, livestock and chickens that the families were raising. They would take their donkeys and mules and oxen to be used for transporting things for the Japanese army. They would press gang young men to carry objects for the Japanese army. Absolute, complete destruction of villages. And the military health is not prepared. They don't have an infrastructure set up for that. And all of this culturally is occurring in a time of complete loss of national pride and confidence. If we want to put this in graph form, you see the blue line shows the United States. China is in the red. So both countries from 1900 to 2000 are going from 47 and 30 life expectancy up to 77 and 71. How does China make that huge leap? That's something we'll discuss a little bit later, but I want you to focus here. Both countries have a severe dip with the worldwide influenza pandemic, which is of course linked to troop movements in World War I. It's because troops are moving that becomes a global pandemic. Everybody has this in their recent memory at World War II. Everybody is nervous that they're going to have another massive pandemic on that scale of an infectious disease that moves with the troops across national borders. And you do see a rather severe dip in China. The numbers, again, I mentioned that the data is not always reliable. The estimates are that 20 to 30 million Chinese lost their lives in World War II. That's both soldiers and civilians, 20 to 30 million. And that's counting direct battle casualties as well as what we would call the associated casualties, the disease, the malnutrition, all of those things. You don't see much of a dip in the U.S. The U.S. is really, I think it's hard to read the map from here, but it's sort of this little dip, that tiny little one just before you get to 69. Right? The U.S. enters very, very late in the war, and they don't have battles other than Pearl Harbor. They don't have battles going on their own soil. I argue that without all of the work of this, what I've been researching around public health, this dip would have been much greater in China. This is a little hard to show you, but let me show you a couple other fuzzy maps. I apologize for the poor quality. These come from the archives. This is a map of 1937 showing you the entire country. It's showing each little dot is a health organization. So you have a couple of concentrations. This is around Nanjing and Shanghai, the two cities I told you about, Nanjing being the capital. This is the Jiangxi Soviet area where the communists are active and they're doing a lot of public health activism. 2 bits of concentration. Just 5 years later, during the war, this is what it looks like. You have an explosion of health organizations, absolute explosion. So how can you account for development of public health during this period of utter chaos? Now you have some sense of how much the chaos was. You also know that World War II started 2 years before Germany invaded Poland, right? At least. We can date the war starting to July 1937. That millions of Chinese lost their lives, 20 to 30 million people, and that there was still a lot of public health work going on. So that's all kind of background. Let's take it into another graph. You see this bit of jump from 1950 to 1970 is the biggest jump in life expectancy, right? China doesn't enter its economic reforms until the 1980s, and from then it's just, oh, sorry, this is not, well, you can see from the graph, it's not going up very much. The age, the life expectancy at birth is just edging up a little bit, right? And now from, this map shows the data from 2010, published in 2011 by the UNDP. 2013, China's at 75. So you can pump a ton of money into advanced hospitals and technology. You're not going to see the same number, same type of improvement as when you're doing very basic public health interventions, right? That's how you get such a big jump between 1950 and 1970, partly also because this is obviously after the war and you have the Communist Party with the stable People's Republic of China, but it's built on the legacy of what happened during the war. This is basic sanitation, clean water, access to clean water, access to soap, access to basic vaccines and sera. That will give you the biggest jump in improvement. So all of this is a contextual background for this organization, the Central Institute of National Medicine. It's founded in 1930, in May 1930, and it has its first meeting, as this photograph shows, in 1931. This organization was founded in response to a particular threat. In 1929, one scholar one particular gentleman in the new Ministry of Health, that had only been founded in 1928, so it's 1928 that the nationalist government has the wherewithal to establish a Ministry of Health. The very next year, this fellow Yu Yan is putting forth a proposal to abolish Chinese medicine entirely. He says, this won't help us at all, it's not scientific, it doesn't have any value. We should just require that everyone have a medical license and within 5 years deny medical licenses to anyone who practices Chinese medicine. This is a very stringent proposal. It's most stringent of any Asian nation at the time. And it doesn't succeed. In fact, it never is passed, in part because this organization, the Central Institute of National Medicine, gathers all of their forces and they resist this. They hold massive rallies, they demonstrate, they send a group of delegates to the central government to petition them. The central government is also very divided on this issue, and most people actually support Chinese medicine within the government, so they don't really want to pass this. And they hold this huge meeting and have this institute. I'm curious if any of you have information that would help us to decode this photograph. So one of the things that a historian has to do is look upon archival documents of the time with, as much as possible, the eyes of the people at the time. So what kinds of clues can we see from this photograph to understand what is the Central Institute of National Medicine? Does anyone have any ideas? Where are they? Who are they? Yes.
The president of the...
Yes. This is the mausoleum, thank you. This is the memorial, the big mausoleum built to Sun Yat-sen, who is by this time revered as the father of the nation. So by posing for this photograph right in front of the mausoleum, which at the time would have been one of the most iconic, immediately recognized, looks like standing in front of Capitol Hill, right? They are saying, we are the medicine of the country. And what about, what are they wearing? Can you see their attire? Mm-hmm. So they're wearing, with the exception of a couple individuals that you can kind of make out, and again, this is an old photograph, it's a bit fuzzy, they're all wearing this changpao. This is the traditional scholar's gown. They're also in the what we might call the uniform of the Republic of China. Many of them have these little bowler hats, right? So they're stylish gentlemen, but they're really signaling by their attire that they are men of Chinese tradition. And there's one woman that I can find right in there, but it's mostly men, right? So this is also a gendered group, and this is the case for Western medicine up until the war period, and also Chinese medicine, that it's really much more populated by male professionals than female. This term guoyi, or national medicine, is what links them to national products movements that will boycott Japanese products and other imported products. It's what links them to the state, just like posing in front of the Sun Yat-sen Memorial. And it's what links them to the idea of Chinese medicine will help our country become strong and face all of these challenges. So they're trying to show that the Chinese medicine will have an important place in the country, and they have to do it in this visible way because they've faced a severe threat from their fellow Chinese. The Central Institute of National Medicine during the war, like all kinds of other organizations, moves to Chongqing. The National Institute of Health, which is just like our NIH, is the seat of government-supported laboratory medicine. That also moves to Chongqing during the war. And you have laboratories. It's not just men doing work in there. You also have women, but they're doing a lot of laboratory science. They're also doing things to promote public health. If any of you saw the flyer for this talk, came from a public health calendar that was produced in 1943 by this institute. That's actually, you can't see it very clearly, but the fuzzy things on the wall are also public health sort of advertising documents that they produced for getting the word out. And you had many, many maternal and children's health clinics. Here you see that the patient, the doctor, the nurse, they're all women. So one thing that really changed during the war is that women entered the medical profession by the thousands at the level of hospital nurses, public health nurses, doctors, midwives, deans of schools. And they are the ones who changed and led to that expansion that I showed you in that map before. People have not paid attention to this before, that it's really the war that changes things professionally for women. So there are health clinics for Afghan all throughout, being built throughout Chongqing and Sichuan province. You have people just going on busy street corners in the spring and fall seasons of contagious disease rampancy, and just literally poking everyone on the side of the street. You know, you need to get a vaccine, you need to get a vaccination done. They vaccinated people by the thousands. And you have really dramatic moments like this, where all of a sudden, a young woman in the 1930s, 1940s, is touching the body of a man she does not know, right? And you can see from this photograph, it's a very tense moment for both of them. Neither of them really knows quite how to deal with this. Prior to this, they had enough men working as nurses that they would have gender-divided wards in almost any clinic. Male nurses would attend to the men, female nurses would attend to the women patients. Now you have men need to go to the battlefront. So all of these nursing positions are taken by women, and then the women are dealing with wounded soldiers and other men. This is a key moment. It's, again, a moment that we can decode in the photograph. And in order to produce this new body of women workers, you have nursing schools all of a sudden graduating huge classes in their nursing schools. And this is the Canadian Mission Hospital based in Chongqing. It had been training nurses since its establishment in the early 20th century, and it's still continued. By the time we get to spring 1942, this red area, it excludes Sakhalin, the islands up here outside of Siberia, but all of this red area is in the control of the Japanese. If you looked very closely at the first map with all of the pink areas showing Japanese colonization, you saw that by the time they got to the south of China, they couldn't really fully take over, so they focused on isolating the port cities. It's a deliberate strategy of economic isolation of China. And when, in spring 1942, the Japanese seized Burma from the British and Indonesia from the Dutch, they now had a complete economic embargo over China. How does China get anything in anymore? Now they're reliant on primarily the United States and the United Kingdom as their main allies in the war. So fortunately, ABMAC, the American Bureau for Medical Aid to China, had been established with a prescient site for what China needed in 1937 as the war started by Chinese Americans in New York. And this organization pumped up its donations into China throughout the war period. This image shows them sorting basic medical implements, right? Basic surgical tools, gauze, all of these things were in short supply across China. And they're sorting them, putting them into boxes to ship directly into the country. And this is a very interesting photograph because the organization was Chinese American. They always had Chinese around, and they had a lot of good media presence. They had Anna May Wong, the very, very famous Chinese American actress who would do benefit parties for them. And they were keen on having Chinese and Americans in the organization throughout all levels. But they did support a lot of work within China. The United States military would send in supplies on these big Dumbo planes, is what they were called, the C-46 commando planes. And that was one of the only ways you could get supplies in. These things, they would have drums of oil, drums of gasoline on them. It sounds very dangerous, but that's the only way you could get fuel to run ambulances in China, right? They had to get anything that you could import. You'd had to fly over the Himalayas after the closing of Burma. And, Chiang Kai-shek is being included. This is the November 1943 Cairo conference. He's part of the top level deals with Roosevelt and Churchill around the war. So this is all context for, this is something that I would like to ask some help in decoding. I believe so this is the medical productions room, the sort of makeshift one, and in Chengdu, the capital of Sichuan province, at West China Union University. This was a combined Christian mission university. And I believe that they might be making penicillin here. So you would have had the preparation in these long tubes. It would have had to stay for a week, about 7 days at 70 degrees. It's not hard to do in Chengdu without any kinds of heating because that's a pretty average temperature there in the fall or the spring, right? Later on it'll get much hotter. And then you have this mixture. This is going to include the penicillium fungus and various sulfates and nitrates. And they could be, in this photograph, in the last stage of draining off at the bottom the ethyl acetate to isolate that potassium penicillin and potassium acetate. And those are the crystals that will form if you're cooling. So I think that this guy might be getting up on a ladder to fan it with his hands or with a fan. I literally think that that might be the way that they were creating some of their drugs in a remote area. Now let me make this clear that there were in several cities around the country, around the unoccupied areas of Free China, the Central and the Northwest Epidemic Prevention Bureaus that were making millions of tubes of vaccine and sera and antitoxins to fight plague and diphtheria and cholera and typhoid and smallpox and tetanus and rabies and meningitis. They were creating all of these vaccines in their central labs. But in places like remote Chengdu, how do you do it? You do it in this kind of makeshift situation, right? And notice what these people are wearing. You have the difference between two white men in white lab coats. Sorry, they're all Chinese, but they're men in white lab coats. These are the supervisors. And the people actually doing the work are in their traditional garb. So let me also tell you that what's happening here as they're making millions of sera, they also have lots and lots of Chinese medicines moving through the port city of Chongqing. Chinese medical drugs. The data I have found show that and there's not a lot of reliable data for the war periods, but in 1931 we know that 31 million jin, that is equal to 15.5 million tons, 15.5 tons of herbal drugs moved through the city of Chongqing. That had a net value of nearly 7 million silver dollars. So that's 1931. In 1943, when the National Health Administration surveyed Chinese medicine pharmacies in Chongqing, of which they had 245 registered pharmacies, and these are pharmacies registered for Chinese medical drugs in that one city, they had a combined annual income of nearly 25 million yuan. That's about $8 million, even though the majority of those shops were quite small. So all of this work is happening in a context where the majority of the movement of medical products has nothing to do with penicillin or vaccines or sera or laboratory work. It's really the Chinese medicines. So they're operating together and they're kind of unseen by one another, if that makes any sense. Unseen in terms of the locations that they take place in, and unseen by the value sets that both ascribe to. But let me just move to Q&A and we can discuss things a little more that you have interest in. Thank you.